Hello, everyone. I am your host, Lauren, and thank you for tuning in and listening to another episode of Empowered with Lauren. We have an unbelievable show today, a show that I believe should be spoken about all the time. We will be talking about a topic which I'm extremely passionate about and which I believe could, should, and will be the cultural and social reform that will liberate women throughout the world. I mean, that's power in itself. Throughout time, women have made decisions and choices based on their biological clock ticking. Today, with the amazing advancement of medicine and technology, we can finally break the biological clock. That is power. Joining us today, I have the honor and the privilege to have one of the leading experts in the field of reproductive medicine, infertility, and egg freezing. Not only is he the be-all in the medical field, he's also, throughout the years, become a personal friend, and he is the reason my husband Michael and I have a beautiful, delicious little girl named Jaxie. I still get all, this person is the reason I get to be called Mommy. Hello, Dr. Tomer Singer, and welcome to
Hi,
Empowered
Lauren.
with Lauren. You know, I still get teary-eyed and I still get all choked up every time I say that. Truly, thank you for joining us. You have given me my love, my true love, and without you, I would never be able to be called Mommy. So thank you. We have a lot to discuss today. We do. First, let's go through your unbelievable credentials, which it's a long time, so we're going to try to shorten them because you've accomplished too much in your life. You make all of us look badly. Dr. Tomer Singer, you're an MD. You also have an MBA. You're an associate professor of OB and GYN at Hofstra Medical School. You just recently left a position as the former director of reproductive endocrinology and infertility, as well as the director of egg freezing program at Northwell Health. You were the department vice chair, and you were also, I think, the director of the residency program responsible for training over 28 OBGYNs in New York. You left all of this to be at a new position at SGF New York as their medical director. So this obviously is an unbelievable opportunity for you to have left. You had every position possible at Northwell. So I'm excited for you. Mazel tov, congratulations. I think it's fabulous. Before we go in on breaking the biological clock, I want our listeners to know that the one thing that stands out, that you make it, or you are very different than so many other doctors, other than being incredibly brilliant, you're empathetic. And I think a lot of it lends itself from your background. Can you tell our listeners what happened in your life, or what was the reason that you decided that you wanted fertility to be your passion?
First of all, thank you, Lauren, for all the compliments, and it's my honor and privilege to have been helping you and Michael conceive Jaxie, beautiful Jaxie. And I think that you're touching upon my personal story of how I decided to go into reproductive endocrinology and infertility. And growing up, I was an only child to my father, who was a quadriplegic of war from age 18. He was shot in the army, and when my mom met him as a volunteer nurse, they knew that they're going to be struggling with their fertility. And after 2 long years of infertility treatment, they finally were able to conceive using an artificial intrauterine insemination. and a medication called Pergonal, which is used to be a European medication. And interestingly enough, 44 years later, I'm using it myself with many of my patients. It's now called Gonal F or Follistim or Menopur. Changed a couple of versions, but essentially it's the same medication my mom injected in her body in 1974 to 76 until I was born. So I think that personal journey made me believe and know that I want to focus on this amazing field of helping couples who struggle with infertility and to conceive, to have a family, to complete their goals and objectives in this world. And I still get excited with every positive fetal heart rate I see on an ultrasound, with every patient who, after long years of infertility and an amazing journey that many of my patients have to go through, are embracing a child and then delivering a baby.
I love that story, and I know that I've been in your waiting room. Patients find out that they're pregnant, and hearing them scream, even when it wasn't me, the joy, you cannot even describe what that feels like. I'm still getting emotional. Well, first let's backtrack. I think it's really important for people to know that I made that choice to hold on and wait because I personally wasn't ready to be a mom. Again, Michael proposed 4 times. I wasn't ready to be married. And I really felt that I needed to have my success, my career. Everyone has their own shtick, and I needed to show that I could make a certain amount of money, achieve a certain amount of success before I was able to be a partner, to be a mother, to be, I had to have my own identity, and I had to go through that journey. And so when I looked into freezing my eggs I was about 34 and a half, back then there was a 42% rate for unfertilized eggs, and it cost about $15,000. Well, as a businesswoman, I didn't think the odds were so great, and I didn't think that was worthwhile. And I decided, though, I still wasn't going to pull the trigger because I believe when you decide to be a mom, my belief, and again, everyone's opinions and their journey is different, but I know for myself, I needed to be all in, and I wasn't ready yet. So I chose at that point to still continue with my career. The truth of the matter is I believe that I was in great shape, and I thought that even though I was 39 or 38 at the time when I was ready to conceive, I thought it was going to be no issue. And unfortunately for me, both Michael and I were both tested, but we had a problem together for whatever reason. And when I went to another clinic or a big name person on Fifth Avenue, didn't have nearly any empathy that you had or you have, and it wasn't a successful situation. I remember speaking to my OBGYN who said to me, Lauren, there's this new hotshot coming up, and he's taken the hospital and the industry, the entire infertility world by storm. I think you may resonate with him. And I remember the day she gave me your number, and it was in November, and I called your office thinking I was going to get either a receptionist or a machine, and lo and behold, Dr. Singer answered his own phone. I don't know if you remember this. You answered your phone and spoke to me directly. I get chills.
I do remember
about that.
I remember just starting the practice, and since then, the practice, of course, has grown tremendously, and I'm very appreciative of that. So I don't answer all the phone calls myself now, but I remember that, and I also remember just starting the practice after I completed my fellowship for 3 years at Cornell, and I was, interested in seeing every patient who called and trying to tackle any issue. And I remember you and Michael coming to my office, and here you are, the same person who I just hopped in a yellow cab and saw her boot camp, taking the city by storm. And then you told me your story and that you were 39 and you had that unsuccessful IVF. And at that point, I said, you know what, we're going to take that journey together. And just like you were a fighter in, establishing your own business, I knew that you can take, this fertility journey, which is in many ways sometimes more challenging than just the physical aspect. I think that the emotional aspect of going through infertility is really one that not a lot of people are expecting when they come to a fertility doctor. They think, there's going to be some pain around the injection site, some bloating, some, mood swings, but the emotional aspect and struggling with infertility. There have been multiple studies that show that struggling with infertility is almost like struggling with cancer and all the things that are thrown at you during this process. So I clearly remember that day.
And I'm going to touch on that. You're 100% right with the struggling of the infertility, because here, as you know, I always think like my body's my temple. I thought that I made all these right decisions. I eat well. I exercise like a lunatic. I never took medicine for birth control because I never wanted to change or trick my body. And here I thought I was doing everything right, and yet I was not able to get pregnant. And it was a mind twist a little. It was definitely it was humbling. But again, I want to stress to the listeners, I would not have changed my journey for anything in the world, because I believe I'm a 10 times more present mom and a happier mom and a much more fulfilled woman that I waited. What I would say, though, is if what is going on now with the advancement in technology and medicine, and we're going to talk about that, because I believe now it's a 95%, correct me if I'm wrong, Dr. Singer, that 95% chance of success for unfertilized eggs, opposed to 13 years ago when there was a 42%. Is that correct?
So, what changed significantly since 2012, there have been multiple studies that looking at the different technology that was used to freeze eggs and thaw eggs. And now with the technique called vitrification or fast freeze, 90 to 95% of eggs that are being frozen thaw and survive and can be fertilized as good as fresh eggs. That changes completely the paradigm. Maybe touching upon the age and fertility aspect, I completely agree that, you should not have looked back and changed anything, and nor should you. The technology, when you were looking at egg freezing, and that was, when you were 34, was a technique called slow freeze. And I've had a lot of patients that were being proactive and froze eggs, and it was much more expensive. And a lot of their eggs did not survive, and they felt like almost like, threw their money away or did not make the right choice. So that was before 2012. In 2012, the American Society of Reproductive Medicine, which is the organization that gives us, the credentials, said that this is no longer experimental. Women should consider freezing eggs if they don't have the right partner, Mr. Right as I call it, or if they're not ready from whatever reason, financial or, in terms of achieving their goals and their careers, freeze their eggs. And the technology is such that you freeze your eggs at age 30, and with each egg, you have about 3% chance of a live birth. And if you take 20 eggs in one process in one egg retrieval, that means about 60% chance of a baby. And I've had multiple patients that had more than one baby with one egg retrieval. And the younger you do the process, the better the outcome is. We know that female fertility begins to decline already in the early 20s, but the pregnancy rate remains pretty high until early 30s. But then what happens in mid-30, when you're looking into freezing eggs, the decline really accelerates until women reaches about age 45, and at that point there's very small chance, almost 0% chance of conception using a fertility treatment using their own eggs. At that point, the main option is using egg donation. In addition, the rate of miscarriage goes up significantly when you're 35 and above. And it's true, when you came in, you're in a great shape, running all those boot camps, and that's very important to be in overall good health. But the most important factor is age. Yes, smoking can affect it badly, family history, ovarian surgery, or radiation or chemo, if God forbid someone had to undergo that, has a negative impact. But when we look at the main factor That has been clearly showed to be age. So I think that in the next decade or so, what we need to emphasize, and I have 2 daughters of my own, is already in high school, mention the decline in egg quality. Mention the option of freezing eggs when you're in college or when you're in your mid-20s, rather than wait to 38 or 39, when at that point, most patients will have to go to multiple egg retrievals to get the same outcome they could have gotten if they did one egg retrieval in their early 20s.
We're going to OBGYNs usually 16, 17 when we get our PAP, and don't you think it's important that we speak about this with our daughters, not in a negative way to scare them, in a positive way, saying, you know what, at 28 years old, right after a few years out of college, we're going to freeze eggs just to take that pressure off the table so you don't make the decisions in life that so many women are faced with, that they've done because they felt that biological clock ticking and they married Mr. Wrong, or maybe they married Mr. Right at the wrong time. And so they felt that they had to crank out these kids. And I know so many women, and we've talked about this, Tomer, that at 35 years old, they have 3 kids. They get up, they look at their husband, they hate his guts. They're like, I hate him. What did I marry him for? I now have 3 kids. Where am I and who am I? And so we don't need to go down that, that path. We don't want your daughter. I don't want my daughter. You have 2 beautiful daughters. And forget about not finding Mr. Right. How about just taking that pressure and saying, you know what? Even if you're dating an amazing man and you're 25 years old, freeze your eggs. So if you want to experience the next 5 years with that man and maybe it doesn't work, you don't feel like, wow, that stupid expression, how mothers always say to their daughters, which I still can't believe with all that we've accomplished, women still say to their daughters, why would the man buy the milk if he can get the cow for free? Or why would they buy the cow if he can get the milk for free? Meaning it's like the biggest thing in the world, all she wants is that daughter to get married because she needs to crank out those kids. If we freeze eggs, let them be able to experience their relationship without that pressure and to know that motherhood will happen. Again, like I said, I would never have taken back my journey, but I will tell you, those 4 IVFs that I went through, emotionally, I remember being on a roller coaster ride. I remember believing that this is it. We had we retrieved 10 eggs at once. We had such unbelievable success. Everything goes a certain way, and then for whatever reason, it didn't take. And then you're going through the medicine again. You're doing the injections. Your body's changing. I remember 3 days before my 40th birthday, I was having a surprise party, which I knew about, by the way. I remember that. And you had to call me in my office, and you had to give me the news that it didn't work again. And I remember
all the embryos were abnormal. Yes.
All of them were abnormal. Yep. And I was crushed. And I remember you being like, Lauren, maybe we should think about another option. Maybe we do a donor egg or a donor sperm. And I said, Tom, I married the big boy for his genes. I mean, he's tall, he's handsome, he's athletic. Let me get something out of this, right? I said, I need to have his genes in you. He started laughing. I said, and it's going to be my egg. It's going to be my egg. Give me one more chance. And I remember crying, and you said, we will do this together. And Michael was saying, should I cancel this party? It was 4 days of surprise party. It was like 100 people coming. And I said, nope, we're going to do this. We have one more shot. We're going to do it. And so, although I had this unbelievable baby, I wish that what was going on now with the technology, and if I could save or help or inspire any other woman, to wait and get pregnant after she establishes who she is as a woman. It doesn't even have to be in a career success, just to find out who you are. Because we don't know who we are at 25 years old. How many women or how many men, how many people know who they truly are at 25, 28, 30, 31? So to take that responsibility, to be a parent, to be a mother, I think that is why so much divorce rate is so high, and so many women, I think I know one woman that got pregnant early that are truly still happy, because she's an anomaly, by the way, because I'm around and I'm an older mom compared to a lot of the mothers with a 5-year-old daughter, and so many of them are not happy because they did not wait. So if I could give any advice on about waiting and establishing who you are, but B, freeze those eggs so you don't have to go through the emotional turmoil, the physical turmoil, and it's costly. I make a joke. We kid around with Jaxie. She's like $1 million kid. She better be brilliant, right? We went through 4 IVFs. So
you'll be surprised, Lauren. Yeah, so one thing that it's important to explain to our listeners is that, even a married couple come in, and even if they're not sure if they want to have a second or third child, a lot of them nowadays, because of the improvement in technology, come and freeze eggs because they're not on the same page. They're not sure they want another child. Sometimes the wife wants it, the husband doesn't want it, sometimes the other way around. So there's a trend that I see on even married couple coming in to freeze eggs or freeze embryos to keep all the options open all the way to age 50 or 51 in case they change their mind. That's one. Two, one other development that happened in the past decade is we have now the ability to analyze the embryos before we even transfer them into the uterus. Just like you were a pioneer in doing that pre-implantation genetic screening on your embryos, and I remember clearly that phone call that we had to go over 2 egg retrievals, use microsperm, create embryos, and then analyze them. And all embryos were chromosomally abnormal, and that was just, at the age 40, 3 days before your 40th birthday. But that helped us understand why you didn't get pregnant up until that point, or the first IVF that you had elsewhere. And then when you told me, I'm up for another retrieval, if you're up to doing it for me, I remember the next cycle that you responded, you got 20 eggs, you woke up from anesthesia yelling, "We did it, baby," and then we got those normal embryos, and one of them is Jaxie.
Your staff thought I was a lunatic still. You were like, "This woman is crazy." I was screaming in the recovery room. We were high-fiving. Yes,
exactly.
I remember that.
You're coming out of the propofol and anesthesia, and you were already with your hands in the air like Rocky. We did it.
I remember it well. Right now, would you tell anyone listening, if they have daughters, nieces, anyone, education is huge, to educate our girls and to let them know there are tremendous options that they should be doing this. We should be talking to our daughters at 16, 17, 18 years old, right?
100%. I think that egg freezing is now what birth control has been or has done for women empowering back in the 60s and 70s. This is something that has to be educated and had to be taught in school, in high school, in college, and give the patient information. They can choose to take that opportunity or not. Go see the OBGYN and not just be scared about cervical cancer and HPV and mammogram and breast cancer and getting a birth control prescription. Educate your patient. Educate your friends and family. Tell them age is here. Age has an impact on your egg quality. If you freeze eggs, you reduce your risk of having chromosomally abnormal pregnancies. You reduce your risk of miscarriages. You increase the chance of having a baby all the way to age 50, which is otherwise unheard of. You can use your own frozen eggs from age 25 or 30 all the way to age 50 or 51, as long as you're healthy. You can decide to transfer 1 embryo at a time instead of transferring 2 embryos, which many of the physicians will do if those are eggs that are derived from a 40-year-old, and reduce the risk of twins, reduce the risk of C-section. And then you can come every 2 years and transfer a single euploid embryo, which is a balanced embryo that does not have chromosomal abnormalities, and build your family with 2, 3, or 1 child every 2 years or 3 years. And you're completely in the pilot seat, in the driver's seat. You decide how your family is going to look, how healthy it's going to be. And I think that whether we like that control or want to leave things to change, This technology is here. It's here to stay. It's empowering to many of the couples, many of the single ladies out there, and we just need to educate them so they can choose how they would like to see their family grow, when, and with whom.
It's taking control. It's having the power where for all the centuries and centuries, women, we didn't have this power. We didn't have this control, and we were dictated, our lives were dictated because of this biological clock ticking, that Michael and I have 2 embryos frozen. And just so our listeners understand, the embryo, so I froze it at 39. And so it stays, so now I have an embryo, a 39-year-old embryo that if I did want to implant, I'm 46 and a half, it is as if I was 39 years old having that embryo. And I think that's a big thing for people to understand. So if they want to do this and to freeze at 28 to 30 and they decide they want to have a baby at 40, they're implanting a 28 or 30-year-old embryo, which is beautiful. Let's talk a little bit about...
In other words, Michael and I still need to work on you for going for that baby number 2 and taking that frozen embryo.
In other words, just so you know, we talked a lot about that, and we're going to touch on something right now. It's going to get personal. Maybe it's TMI, but we're going to talk about this. After going through our journey of having 4 IVFs and having chromosomal issues and finding out that there was all these abnormalities, we would not get pregnant naturally. For example, I don't want to have unprotected sex because if I do get pregnant, that scares me for everything that I know. If I get pregnant naturally, I would only want to be pregnant with the embryos that we have stored. And I think
I hear it a lot. I hear it a lot from patients. But, you know, it's important to put things in perspective because still most women will get pregnant spontaneously. Most women will have an uneventful pregnancy. It is true that at age 40, when, you and I did the fertility treatment, most of the embryos are already chromosomally abnormal, unfortunately. And this is how the woman body was programmed. But the fact of the matter is that despite that statistics, at age 40, the chances of a miscarriage due to chromosomal abnormalities is still less than 50%. At age 44 or 45, however, 80 to 90% of the pregnancies will result in a miscarriage. So I think that once you've seen those 2 cycles that had all chromosomally abnormal embryos, it got you obviously nervous, and I can see why a lot of my patients will say, now that I have the technology to test my embryos, why would I want to have a miscarriage due to chromosomal abnormalities? Why would I have to waste 3 to 6 months from that time of a pregnancy test and an ultrasound and then finding out at 10 weeks with a blood test that there's an issue? So it is true that at age 44, 45, it's very unlikely to get pregnant with your own eggs, and if you do end up getting pregnant, more than 80 to 90% will end up in a miscarriage. But I don't want our listener to be discouraged and not have unprotected intercourse because, of course, most of the pregnancies are still achieved with Frank Sinatra and a glass of wine.
I could always use Frank Sinatra, and I would go with a glass of champagne because you don't fancy that way. And by the way, you're the only man that's seen my hoo-ha or my toonie that my husband loves and wants to go out to dinner with all the time.
And we've had several dinners along the years.
And you didn't even have to buy me dinner. And you've seen me at my toonie so much. You see the pluses in your career? Right?
That's how great your husband is.
Let's talk about what makes SGF so unique. I mean, here you left this. You were the chief chancho over at Northwell, and obviously you believe and you know that SGF is special. Talk
Correct.
to us about what makes this special. I mean, I know this, like that you think you have 36 locations throughout, I think, New York, Maryland, Pennsylvania, Correct. Georgia, Florida, D.C. I think we've spoken about that. I think you've produced 85,000 or more babies that have been born at SGF. But Correct,
in the past 25 years.
That's unbelievable. Tell us in your words what made you make the switch and why you are such a believer of SGF.
So, SGF is one of the largest fertility centers in the nation that focuses just on fertility treatment. As you mentioned, 36 locations, 7 IVF labs, ranging all the way from Florida to Maryland, New York. Now, as of the last 3 months, we opened a brand new IVF center here on 60th and Park Avenue. I've joined with my partner, Dr. Anat Brower, who's amazing. She was my co-fellow at Cornell. We've known each other for 15 years. We practiced very similarly, both had good training, and we were joined with a third physician in the summer, opening an office in Brooklyn. But, I've been in touch with the SGF along the years, and they have over 51 physicians, all top-notch physicians throughout the nation. The focus is to help a family, to help the couple leave with a baby. They have options from all the way from just simple insemination and fertility workup, what we call a low-tech technology, to egg freezing, to IVF, to donor egg, to gestational carrier. We have, given the fact that we have centers throughout the nation and each state has different rules and regulation, we have the option of lowering the cost of fertility and making it much more accessible. The SGF has several programs that are very unique that when I spoke to SGF for the first time, I could not believe that this is even possible. The first thing is when it comes to egg freezing, we have a program that's called Assure 20 or Assure 30. And that program basically guarantees the patient that freezes eggs to have 20 mature eggs or 30 mature eggs at the one flat fee. And if she doesn't get that in one retrieval or two retrievals, she can go to a third, fourth, and fifth retrieval free of charge. We want our patient to come in and leave with the outcome that they are desiring. That's one.
No other clinic in the world does this, right? No other doctor or clinic. That's unbelievable.
I'm not aware of any program that offers 20 mature eggs in one flat fee or up to 4 retrievals. And I'm sure that now that SGF has promoted this program, maybe followers will come along, but this is a unique program. The second program, when it comes to egg freezing, if a patient freezes eggs with us at SGF in New York here or in any other centers, we have a guarantee program that if you did not take a baby from the eggs that were used while frozen at SGF, you'll get all your money back from the thawing of the eggs, fertilizing them, creating embryos, and transferring. So you can use that money and use it towards a different route of getting pregnant. Those are 2 unique programs that are in the egg freezing program. The third unique program is shared risk IVF. A lot of patients come to us and they don't have IVF coverage, or they've went through a couple of cycles and were not successful. When they come to us and they do an IVF with shared risk, they have to qualify. There are certain criteria, of course. But then if they don't get pregnant with the first or second IVF, there is a program that guarantees a baby or their money back. And that's a very, very unique program because, as we know, you said it yourself with Jaxie, you had to go through 4 IVF to get to that one normal embryo. And if you had to pay per cycle out of pocket, that will be an enormous amount of money. So that is SGF recognizing that the financial aspect is the rate-limiting step in patient freezing eggs or in patient having a baby or having a second child. And that's something that says a lot about the organization. We know that we've helped over 25,000 babies in the past just 10 years and 85,000 babies in the last 25 years since SGF was started in the early 90s. And we stand behind the product, behind the retrieval, behind the lab, behind the personal care that we provide. The third unique program is when it comes to donor egg. As you'd mentioned yourself, when a patient meets Mr. Right at the older age, or she's getting married again and she's now over 43 or 44 and is need for egg donation, we can recruit donors throughout our 36 location and make it much more affordable. We have an option of thawing eggs from our egg bank or splitting eggs from 3 different locations and basically fertilizing those eggs with the husband's sperm and able to split that cost among 2 or 3 recipients. In a way, instead of paying 3 times the price of an egg donation, you can really pay a third and end up with the same outcome without having to have excess embryos that you may never use. So those are unique programs that basically show me and show our patient that we're here for you. We basically have different options. You need to delve into those options, discuss it with your partner, discuss it with your family support system, and decide how you want to achieve your pregnancy. And lastly, something that I wasn't able to offer a lot of my patients was the gestational carrier options. Given that New York State is a restrictive state, and we cannot do a gestational care treatment for payment, we can only do it for altruistic reasons, we can create the embryos here in Manhattan, transfer the embryo to Philadelphia, transfer it to Georgia, to Florida, do the transfer over there, and then achieve the viable pregnancy and carry the pregnancy by a certified gestational carrier, and then get all the documents done here in New York so you can have your own genetic child with someone else carrying the pregnancy. And that helps a lot of patient with cancer, patient that lost their uterus during a C-section, patient that were born without uterus, patient with very large fibroid uterus who are at risk for carrying their own baby. Know that there are different ways of having a family and establish a family, and some families have a baby with 4 different parents, a donor egg, a donor sperm, a gestational carrier, and of course the mom who chose those additional parents.
SGF sounds unbelievable, and it's the one place, it's kind of like putting your money where your mouth is and saying, we believe in you, we are not taking your money unless you go home with that baby.
That's correct.
I know you offer counseling at SGF. There's acupuncture, there's nutrition. I hear there's a Fit to Be Fertile program. I think I need to be called in for one of these programs to facilitate, but we'll talk about that at another date. There is so much going on at SGF, and I'm so happy because for you, I know what you have gone through in your career. I know how passionate you are in your career, and I think this is finally your home. And
it is.
I know you're gonna flourish and be the rock star that you always are. There's one thing I like to say. One more thing before that is that I think there's a societal negative connotation with freezing eggs. And I think that needs to be taken off the table, and it needs to be looked at as we talked about it before, as this is giving power to girls and
I
women.
Agree.
And it should not be negative in any way.
It is already changing. I think that the discussions like we're having today is, another step in the right direction. When I started, seeing patients and talking about egg freezing, and they were afraid to even mention it to their parents, and we were doing 1 or 2 cycles a month, and now we're doing, dozens a week because it's so empowering, and a lot of celebrities have come, through and said, we did it, you should do it. Women that have the passion that you have to discuss it with the next generation are doing an amazing job of educating our young girls. It's important to know that it's not covered by insurance throughout the country. Some insurances still cover egg freezing, Google, Facebook, Amazon, but not all of our managed care providers are covering egg freezing. That's something that we need to push our legislators, because this is just like a vaccination for HPV in my book. If you're young and you're freezing eggs, you're not going to need 3 or 4 IVFs. You're not going to have to deal with the twins because someone is transferring 2 embryos. You're not going to have all the complications that come along with each one of those pregnancies at age 42 or 45, because you have healthy eggs that are stored in a safe environment. And I think that's very empowering. That's very important for our patients. We do a lot of international patient and out-of-state patient, and they get free consultation just to educate them. So our 51 physicians are getting on the phone a few hours every week. They do seminars. They basically are out in the community talking about it, because no one else is, as educated as the fertility doctors who are getting all the data, reading the literature, and we're in a position of power to educate our patient, our friends, family, and that's how we're going to spread the word that this is not a shame to freeze eggs. Just because you don't have Mr. Right at age 30, that doesn't mean that you're not going to find it. Just because you're not ready to have a baby, as much as your mom wants you to, it doesn't mean that you should get pregnant for the wrong reason.
Exactly. That's the most important thing I think our girl should hear. It's when you're ready. So right now, currently, is it about 8,500 to 9,000? I know that when I was looking at it years ago, it was about 15 grand, but I think it's changed.
It's $7,500. Yes. So a cycle of freezing eggs at SGF New York is specifically low because of our commitment. It's $7,500 plus anesthesia, which is $500 plus the annual storage after the first year and the medication. So it comes out, to be much more affordable than it was just about 2 or 3 years ago. Yeah. So I think that
and can you
that's
do
the key to lower the cost.
You want to lower the cost, and I think, can you do a payment plan?
Correct.
Yes.
You can spread it over 5 years. You can decide to take a loan that we're basically keeping at a low APR to make sure that even students in their graduate school can afford doing that, in addition to all the school loans. And what I've been seeing is that grandmas were paying for their granddaughters' egg freezing to make sure that they are going to have kids. It's interesting
I love that
phenomenon here in the city.
See, grandmas know. Grandmas know best. I love that. Grandmas are forward thinkers and understand this is the best investment you can do for a young girl, young woman. And I know you and I spoke about this. You plan on doing this for both your daughters, right?
Correct. I have 2 daughters and a son. So my 8-year-old and 9-year-old, they don't know that yet. But when they're going to be 20 or 22, that's going to be their gift from me. For me to them, it's a kind of a gift from me to myself.
You're going to be the best grandpa there is. I love that.
Definitely easier than being a parent. You know that.
Well, you're running around and you got 3, so that you're always on your toes. I thank you so much, Dr. Tomer Singer, for coming in here, speaking to us, educating us, and I truly believe this is going to liberate our young women. I do believe this is the most important topic that needs to be discussed in every single home. This changes the landscape for girls around the world. Make right decisions, not based on that biological clock. We're breaking the biological clock. And to embrace each other, to educate one another, and to show that there is no one right answer for any person, but to give people the tools to make the right decisions is pure power. Dr. Singer, thank you so much for joining us today on Empowered with Lauren and educating us all on this groundbreaking topic. You always have a very special place in my heart, and I am truly excited to walk through the doors of SGF. You are an amazing man and a brilliant doctor. You change people's lives. You give them the gift of life. To learn more about Dr. Singer and SGF, please visit the website www.shadygrovefertility.com. And you can always visit my website at www.empoweredwithlauren.com. Please spread the word. You can always subscribe to the podcast. To each and every one of you, I wish you an amazing, wonderful holiday season filled with health, friendship, and peace. Until next time.